had looking into this reticulospinal tract, the lateral and medial. So lateral is concerned uh, function of lateral reticulospinal tract. It increases the muscle tone, whereas the medial reticulospinal tract, it inhibits gamma efferent, so it decreases the muscle tone and also inhibit the anti-gravity extensor muscles. The next tract is olivospinal tract. So olivospinal tract, it arises from the inferior olivary nucleus uh, of the in the medulla and is found in the cervical region, the spinal cord. The function of it is unknown. So there is an intermediate pathway, what we call it as striato-olivospinal connection. This also function is not known. It is said that it makes a link between basal ganglia, inferior olivary nucleus, and spinal cord. Like so, each function we will look into, like each tract. Corticospinal tract is mainly for fine, discrete, skill, voluntary movement. Rubrospinal for mainly it's an accessory route for transmission of relative discrete signal from motor cortex to spinal cord. Vestibulospinal controls posture and writing reflex. Tectospinal mediate or facilitate turning of head in response to visual or auditory signal. Reticulospinal tract, either it excite or inhibit the voluntary muscle tone. Other than that, it has got some influence on motor function and reflex movement. And this finishes the extra pyramidal tract. So basically, extra pyramidal tract are rubrospinal, tectospinal, reticulospinal, vestibulospinal. Like, and we have looked into also the difference between upper motor neuron lesion and the lower motor neuron lesion, which is very important from exam point of view. Like, so upper motor neuron lesion lead to paralysis, what you call as spastic paralysis, whereas lower motor neuron lesion, flaccid paralysis. Upper motor neuron, so there will be loss of superficial reflexes and deep reflexes become exaggerated due to increased gamma discharge. And upper motor, there's a clonus present, and there will be a group of muscles is affected and no atrophy of muscle. Babinski sign positive, very important. And there will be one more thing, what we call it as a class knife reaction. In lower motor neuron lesion, so there will be all reflexes will be absent, superficial muscles are affected, and these muscles will be atrophy, what you call disuse atrophy, and you can elicit fasciculation and contracture seen in the muscle, and Babinski sign is negative. Right? So all this you need to know uh, of the difference between uh, upper motor and the lower motor neuron palsy. Like, so one few important things which you need to know before I conclude today's lecture is, so both pyramidal as well as extrapyramidal tract cause effect on motor neurons of opposite side of spinal cord. That is the most important thing. The other important thing is some pyramidal tract fibers end on interneurons that play important role in posture, whereas extrapyramidal fibers end directly on alpha motor neuron to control this discrete muscle movements. Because of this extra control mechanism, loss of function resulting from damage to one system may be compensated for by the remaining system. So although the compensation, whatever happening, is not a complete process. And total separation of function between pyramidal and extrapyramidal is not clearly cut. So therefore, all movements, whether an automatic or a voluntary, requires continuous coordination and interaction of both these systems. That is a very important point you need to know. Like total separation of function between pyramidal and extrapyramidal tract is not clear cut. As a result, all movements, whether it can be voluntary movements or an automatic movement, it requires a continuous coordinated interaction of both these systems. So there is a one more thing is this, what we call it as if you look at like which is that center role played in this continuous coordination, mainly done by cerebellum. Center role in ensuring the movements that takes place in a smooth and a well coordinated way. Like so, other things we have studied is the lesions of pyramidal tract, hemiplegia. Hemiplegia means paralysis of one side of the body. So if you look at the stages of hemiplegia also, there will be an acute stage, what we call it as like what you have studied in the um, uh, complete transection of spinal cord. Like the same here also it will follow, like stage of spinal shock, stage of reflex recovery of reflex activity, and stage of reflex failure. Like so these are the things which you need to know for from the today's class. Like so thank you very much. If you have any doubt, you can ask me. Like you can either WhatsApp me or you can email me. Like so next week also I'll take some classes, online classes. I will let you know what are the topics. Thank you very much.